So can imagery and virtual reality be helpful in functional neurologic disorders or things like 3PD or actually many other conditions? Yes, it can. And we're going to talk about why and how that could be helpful. And particularly because we just shared a case where we used this a whole lot today, and it really got me thinking about virtual reality. So I want to say hello because first of all, I saw Amy pop on. Hi, Amy. Oh, I see Julia. Hi, Julia. Zach, what's up? I'm just seeing a lot of familiar, hi, Melissa, a lot of familiar faces. So I just wanted to say hello. Thank you for joining me live. If we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist. I'm based in the Los Angeles area. I am the owner and founder of Reactive Therapy and Wellness. And we share a lot about what we're doing, what we're learning. And honestly, I learn a lot from my own team. And I got to share this with you because this was some of the inspiration for today. This was I'm just sharing the picture here. Harrison, one of our amazing physical therapists, shared this case with me. This was a young person who has hypermobile EDS, as well as chronic pain, and wanted to get back to surfing. And they started with some virtual reality training. Actually, they started with some sensory training. Added in the virtual reality. You can see he's wearing the Oculus. He's got the little hand parts of the Oculus. I don't know what those are called. But somebody had asked me what we have used, and it's the Oculus. It's really a fairly inexpensive gaming device. And I don't know if you can see it, but what Harrison's actually doing is having him watch a video, which let me just show you. It was something to the effect of this. So it was a video like he was walking to the water in Bora Bora, one of his favorite places. I would love to go there someday, by the way. And what you maybe couldn't see in Harrison's video here, well, you'll see it in the video, but maybe not in this picture. Harrison is watching the video that is in the Oculus. The person is imagining they're walking there, they're watching it, and Harrison's actually splashing water on the feet at the same time that the ocean is rising to the person's feet in the virtual reality. I thought that was so innovative and fun that I just had to share it. And what is so cool, let me show this. Then it was working on getting back to surfing. So a progression to get there, of course, but really getting back to life for a person who had not been able to do these things. So this really got me thinking. This is something that we do a lot. Maybe I shouldn't say a lot. We use it as a part of treatment, is some sort of imagery, whether that's mental imagery or an action observation, meaning the person is watching something and taking action, so they're observing and acting, or it's full virtual reality. Any modes of those can be really helpful as a part of treatment for a lot of disorders. A lot of the research, by the way, comes from the world, the pain world, amputees, and has been translated to a lot of other things, post-stroke, in Parkinson's, but yes, in FND and 3PD. So I wanted to share this article today. So this article is actually a review and a kind of a call to research. So there's the beginnings of research in this area, but frankly, not enough. And so this was written by a group out of the UK, I believe, and it's called Virtual Reality in Functional Neurologic Disorder, a Theoretical Framework and Research Agenda for Use in the Real World. This came out in July of this year, and it is available free full text, so you can look it up. But if you're already on our newsletter, you know I'm going to send it out. So every week when when I finish up the week, all of our videos and resources, any links, any articles, I send them out in our newsletter. I have a newsletter for clinicians that goes out on Friday and a newsletter for patients that goes out on Monday with similar links, but I talk to you about different things. So you can sign up there on our website, reactivept.com if you're a patient, or reactiveeducation.com if you're a therapist. But if you're on our newsletter, this is coming your way. So look out for it. So let's talk a little bit about this article, because again, this wasn't a trial, but they reviewed a lot of trials. And I think interestingly, there is a growth in trials in this realm. And particularly if you look at, they had this really nice visual of the number of trials looking at BR. In the last, these are enrolled on clinicaltrials.gov. The largest group is in pain. So pain, anxiety, and stroke are the top disorders, but also on there are cancer, cognitive impairment, Parkinson's disease, cerebral palsy, depression, and brain injury. I personally think, and so do the authors, that there is a huge opportunity to use imagery and virtual reality in functional neurologic disorders. And they describe some of the literature that's already been done. So I wanted to share that with you. It's probably going to be really tiny. Yes. So again, I'll share the link in our newsletter this week, but they shared 2 tables. I love a good table. You probably know that about me. And I love to see when folks have summarized research. And particularly they summarize, this is the table for 3PD, all the published research to date on the applications of virtual reality in 3PD. And 3PD is persistent, I always get the order of these P's wrong, postural perceptual dizziness. It's a form of functional dizziness that can occur. And what you can see in this list of studies, gosh, I think there's about 9 or 10 of them, is they have done some fMRI studies. They have done some case control studies. There's been a randomized controlled trial of VR in 3PD as well. So there has been more in the realm of 3PD. And one of the randomized controlled trial, this was Choi and colleagues trial where they did 4 weeks of training. They found significant improvements in the dizziness handicap inventory, activities of daily living, visual vertigo scale, and timed up and go. So there's some nice preliminary evidence that the use of VR can be really helpful in folks with 3PD. In this other table, so let me grab this table. I think it's this one. Yeah, so these are the studies in FND. Actually, not as many as in 3PD. I think there's maybe 4 studies, and they're small. So case reports, case control studies. One of them is a really interesting study that looked at fMRI. So this is the study by Nahab and colleagues where they looked at sense of agency in a virtual reality environment and looked at what some of the differences were brain-wise between people with FND and controls. And this is one of the reasons that I think FND, folks with FND could potentially respond really positively to a virtual reality environment is to help restore that sense of agency. And so I want to talk a little bit, hold on, let me take this down. I want to talk a little bit about why would this be helpful? And the authors put it into really a nice framework based on what we know and understand about FND and mechanisms. So one of those mechanisms due to this predictive brain issue, I should say, where there's a high amount of emphasis put on some predictive brain processes versus the sensory feedback. And this is where virtual reality could come in handy to improve some of that sensory feedback in order for the person to update some of those predictions that are occurring and causing the abnormal movement. Because in a virtual world, you can actually control some of that feedback, which is really very cool. Second is, one is that predictive updating. The second is that sense of agency or control. So we also know in functional neurologic disorders that most folks have a decreased sense of control, voluntary control of their movement. So I'm talking primarily with functional movement disorders then. And this sense of agency really relies on feedback from the body and from our sensations. And this is something that, again, can be particularly addressed in a virtual reality environment. There's evidence, actually, that virtual reality can alter a person's sense of agency. And this then can be something that is really helpful in our rehab. So that's something that I think about all of the time with the example that Harrison shared today in the video was improving that person's sense of control to get back to surfing, to get back to walking and feeling the sand and feeling water on their feet without symptoms. So I think that's really exciting. So self-agency impaired in functional neurologic disorders and virtual reality might be a mode to improve that control. The second piece is attention. And by the way, I think these are, let me pull these up. There was this lovely little diagram in here that looked at these components. I was most interested in the agency, attention component of mechanism and of treatment. And we use things like mirror therapy quite a bit because that is part of really lighting up some of those mirror neurons and improving that sensory motor control and feedback. But attention, so you'll see in here self-agency, you'll see attention. Attention has also been implicated as a potential mechanistic piece of functional neurologic disorder. And the body-focused attention specifically can become problematic. Now, we talk about this a lot when it comes to treatment in turning, particularly in physical therapy, turning cues away from the body, like squeeze your glutes, to like that's internal, that's in your body, right? To an attention to a goal-oriented task, like bop the balloon with your head when you come to stand up. That would be an externally focused cue. Well, you can only imagine in a virtual reality environment how much external focus you could really have, right? So we can use, I'm going to go back to this example here. So in the example of the video that we shared earlier today, the person has the headset on, they're seeing this video. So This is a still picture, but it's actually moving like the person's moving on it. And this is very externally focused, right? So it's in an environment, the goal is walking towards the water, right? So we can put somebody, this is the cool thing for us as clinicians, we can put somebody in an environment that is really salient or important to them, right? So it doesn't just have to be a video game, which the Oculus also has a ton of video games. You can stream Netflix and YouTube and all kinds of other ways to immerse somebody in something that's very specific to them. And then make the goal about that external focus, right? So I think that offers us loads of opportunities and opens up doors for us to practice in very different ways. So again, this article really talks about how attention can be manipulated in a virtual reality environment, and you can provide all kinds of feedback. So I'll just go back to this picture as an example of what Harrison was doing here. So he's actually providing some feedback onto the foot, right, of water. And I'm guessing it's Bora Bora, then maybe it was kind of warm water too, not like cold water here in California, but like warm water on the feet. So you can provide that kind of feedback in addition to the visual input from the virtual reality. So there's a lot of opportunity to reduce bodily focus, internally focused attention, and improve external focus of attention in a virtual reality environment. I think that is really powerful. So I want to go back here to the study here. One of the things that they talk about with some of the virtual reality-based treatments is that they can be really helpful to decrease some of the avoiding of activity that is really common and very protective for people. So oftentimes with FND or 3PD or pain, a person may avoid an activity or many activities. That makes a lot of sense because they're having symptoms, and some activities might increase those symptoms. In a virtual reality environment, we might be able to progress activity level in a little more controlled way and essentially grade that exposure. That's where virtual reality has been very helpful for folks with chronic pain, and I see a parallel for treatment in FND and 3PD as well. Another really great usefulness that the authors talk about virtual reality is they can improve sustainability of practice, accessibility of practice. So this might be something that you could try out in therapy and then be able to progress alone at home, right? And so this, for people that maybe have to come a far distance for therapy, this could be really helpful. And I have worked with several companies to consult on different devices about how a therapist might then check in on a person in their program doing this kind of rehab, which can be really helpful. I see a couple questions coming through, so I love your questions. Hi, Julia. Would virtual reality be helpful for surfaces? Ooh, I love this. Surfaces that are challenging, for example, wood chips and snow. 100%, I think that could be helpful. So, one of the really nice things about virtual reality, and for something as simple as the Oculus, which is a gaming-based platform. So this is not. I've investigated some of the other rehab-based platforms, which are very expensive. Something like the Oculus could be used at home. I wish I had. I'll use my iPad for example. It doesn't have to be a fully immersive environment either. So you can, and we do this as well, is you can use an immersive video, and especially good with a bigger screen. So let's say, Julia, you wanted to start with wood chips, or start with snow, whichever one is easier, right? You might get video of first person view, so a point of view video where it looks like you are walking through the wood chips or walking through the snow. So if you don't have access to virtual reality, you might just do it with a first person video. Watch it as you are walking. And you might do that walking first just on a treadmill, or just over ground, or just over grass, or over a surface that you already know is helpful before you encounter the actual surface. So that is, obviously in therapy, we couldn't go to Bora Bora, but we could act it out quite a bit. But that was a progression to being able to do that at the actual sand and ocean, right? So I think that would be a really great way to do it. And if it's, so wood chips, you could actually start with watching and walking, and then maybe you add some of the smell, right? So you can add some of the other sensations. I love the smell of wood chips. So you might just add in smelling that to your experience. And then you might add walking on a few wood chips, right? And then more, and so on. So that could be a way to increase your, body's response to being able to do that with the correct balance and sensory integration and so on. Now I'm saying all of this and I would like to try it out with a person, right? So I think it can be hard to know exactly where to start, but I'm giving you some suggestions and you might try it with a physical therapist. Amy, great question. How have your clients with 3PD responded to VR regarding their dizziness? Really good question. So this is like one of my number one questions with VR in general, is some people get sensitive motion-wise with it. And so what I have found for folks that might get dizzy is I give them more sensory input with the virtual reality. So maybe that's a harness, maybe that's actually some compression and ramps, maybe that's some extra weight, maybe we do it in sitting first. But I will tell you, I've worked with a couple of the really amazing researchers at the University of Southern California who are working on this technology. I've worked with them, worked with other patients with it. There are just some people, it's not even something they want to try. They just know that it's not for them. I'm definitely not going to do it because I think there's so many things that are in our toolbox that are not virtual reality that for the person that is really against it, I'm not going to do it. But for the person's like, yeah, I think I want to try it. I'm a little worried that I might get motion sick or something. Then together we'll create a few tools to go with it. Now, I did not realize, Amy, so this is such a good question with 3PD. I did not realize how much literature there already was about virtual reality and 3PD. When I looked at this article, I was like, wow, there's 10 articles, and there's a randomized controlled trial. I think I just missed those. I didn't know those existed. And although I had definitely tried similar things in 3PD, I just didn't know that literature was there. It is compelling to me, Amy, to really consider trying this a little bit more. So yeah, it's a great question. And yeah, Julia, you'll have to let us know if you try some of these things and how would it go. I saw a question up here from Tamika Love. Hello, I have a question. My neurologist said FND is genetic, hereditary is the word he used. Can you help me understand that, please? That's a really good question. And I think I'd want to know what your neurologist was referring to. But just like many neurologic disorders, FND, functional neurologic disorder, is multifactorial. And some folks might have a genetic or family predisposition, but there has not been identified, at least to my knowledge, and I read a lot on FND, there's not been identified a distinct genetic or hereditary marker in functional neurologic disorder. However, there has been seen that you might see it more commonly in families, which could indicate that potentially in the future we will find a genetic marker. Now, there are other disorders that we see a lot alongside FND that are genetic. So Ehlers-Danlos syndrome, there's a genetic component to a type of Ehlers-Danlos syndrome. So that could be a comorbid condition with functional neurologic disorder. Migraine as well can have a genetic component. So I just don't think or have not heard that FND on its own is that we found a genetic marker for it, but we can certainly see things run in families. Okay, good question. If you have MDDDS, so Mal-Day-Debarkment syndrome, and 3PD, is VR safe? It's a good question. I don't know that I've used it on a person with both of those diagnoses. I think to try some of these things, I would do it with a PT. A lot of these things are very safe. It's just most helpful to do it with a person that can set you up in the safest environment. Because of course, when we're doing things, we want to ensure that the person might not be falling, or at least not having an injurious fall. And as with anything, if you're trying something new and you have you have a loss of balance, that could occur. So what I would say is it might be safe, and I would try it with a physical therapist. Great question. And that's what I would say with all of the things that I recommend. We try so many different things, sensory things and motor control and autonomic. And what's helpful for one person could be a lot less helpful for other people. And so you want to try it with a clinician if you can. There you had it, a little tour into imagery and virtual reality and FND and 3PD. Amy said she's going to check it out. I was going to pull up the Choi article. Let me just give you the full name. Choi and colleagues. It's from 2021 Scientific Reports. It's called Effect of Vestibular Exercise and Optokinetic Stimulation Using Virtual Reality in Persistent Postural Perceptual Dizziness. Oh, wait. I got it. I got it right. So just from 2021, that was the randomized controlled trial. Another one also from 2021 was customized vestibular rehabilitation with the addition of virtual reality-based therapy in the management of 3PD. This was Mempao is the first author of that one from 2021. That one, what sounded really cool about it, by the way, Amy, was that it was more of kind of a real life setting. Like, we're going to do vestibular rehab and we're going to add virtual reality, which, if you ask me, I cannot imagine a time I would only do virtual reality. Most of these studies, when they're trying to be very specific, that's like all they're doing. And like, that is never all of what we would do, right? We're going to take a whole person approach and we're going to use a lot of different things. So what I think is cool about that study, the second study, it's not a randomized controlled trial, but it's more practical, which I think is really helpful. So anyway, that's just two of the 3PD articles. And by the way, what really got me going on the mental imagery aspect of treatment of many of these disorders is also how mental imagery can be very regulating to the nervous system. And this is a tool that our psychology team, our occupational therapy team use a lot in therapy. And our psychology team put together a free resource for other mental health care professionals and people with FND. We just released it last week. And it is 3 strategies for nervous system regulation. And it goes through breath work, externally focused breath work, mental imagery, and imagined movements and things like that. And it goes through sensory grounding. These are 3 things our psychology team incorporates into therapy all of the time, as well as the rest of our team. But they created this resource to help empower other mental healthcare professionals, as well as people with FND, to think outside of the box and look at the whole person to provide a lot of tools within therapy. So they created this free resource. You can download it. And our post earlier today, actually, if you comment on that post, we'll send you the link to that free resource. But you can always send me a message. I'll send you a link to it as well. But that talk, we were talking about imagined movements. We were talking about mental imagery, how powerful it is, not only for attention and self-agency, but regulation of the nervous system. And I thought that was so very powerful. I personally feel like maybe I don't use it enough, and I should. So this was kind of a little reminder to myself of something else in my toolbox that we can use. So I want to thank you so much for joining me tonight. I love this community so much. I love the questions, the comments that you ask. I just want to thank you so much for being here and for being so curious alongside of me, for asking great questions so we can dive in them together. I will see you again very soon, and thanks for coming.